Coronavirus infections in nursing homes and long-term care facilities are on the rise again. The Associated Press analyzed data compiled in 20 states and found that new weekly cases among residents rose nearly fourfold from the end of May to late October. And weekly cases among nursing home staff more than quadrupled in the same time period. This is in spite of the Trump administration's promise that it could create a protective bubble around nursing homes, allocating billions and sending thousands of rapid test kits. Tamara Konecka, who the AP identifies as a nationally recognized expert on long-term care, explains trying to protect nursing home residents without controlling community spread is a losing battle. Someone has to care for vulnerable nursing home residents, and those caregivers move in and out of the nursing home daily, providing an easy pathway for the virus to enter. Joining me now is Dr. Ashok Rai. He joins us from Wisconsin. Dr. Rai, thank you so much. You're also the president and CEO of Previa Health and an internal medicine physician in Wisconsin. You're currently caring for COVID-19 patients inside nursing homes. I want to talk about community spread and why this isn't just about the caregivers going in and being, some people might think, careless with their patients. The study found that it's not the caregiver's fault in these scenarios.
No, it's really not. You know, like the article pointed out, when you have a high percentage of cases in your community, I live in Green Bay, Wisconsin, Brown County, our percent positivity over the last 14 days, the rolling average is 40%. You know, in New York, I think people get nervous when it's 5%. So just, you know, think about just how much COVID is spreading in our community. It's impossible to create any kind of bubble. It's not only staff going in and out, you know, food delivery, whatever it may be. It's impossible to purely protect, no matter how good they are about sanitization and personal protective equipment. And everybody in that building is at risk. You know, if you think about the definition of who's in a nursing home, and once one person gets it, it spreads like wildfire.
Yeah. So I guess what's the message to the community in order to protect grandparents and parents, your loved ones who are in these long-term care facilities?
You know, to truly protect them, we need to control the community spread. There is no bubble here. You can test staff members as much as you want. We need to control what's going on in the community to protect our most vulnerable. We've said that since March, and we continue to say it today. This isn't always about you. It's about protecting those that are most vulnerable, and our most vulnerable happen to live in a nursing home.
How are Wisconsinites taking that message? I mean, do they see it as a message that's not just about them, not just about their protection by wearing a mask, not just maybe about their immediate family, but the family of their neighbors or the family of a person they've never met who they might encounter in a grocery store?
You know, unfortunately, and it goes well beyond Wisconsin, we haven't been able to translate that message very well. You know, we don't wear a mask to protect ourselves. We wear it to protect the next person we're going to encounter, and that person is going to encounter somebody else. We stay separated at Thanksgiving, not to protect always ourselves. We may be able to have COVID-19 and do very well. We do it to protect our parents or their friends that they may interact with. It's, you know, we are in this together, but for it to work, we have to do all the right things to protect that population. And unfortunately, I wouldn't say behavior is translated very well. As you can see in Wisconsin, the surge is huge, and it's because people aren't doing the basics.
You know, Tony Evers is trying to get more money to the state. He's also been trying to institute mandates. It's met with a lot of resistance from some of the local leaders, certainly the Republican Party in Wisconsin. What do you need to see from leadership across the board in Wisconsin to help drill this message home? Is it possible to drill this message home at this stage in the game?
You know, we can't throw in the towel, so it's never too late. We have to put politics aside. Don't care what side of the aisle you're on. Come to the nursing home, see how sick people are, but you'll have to see them from the windows because we can't let you in just given the rate of spread. And the politicians need to do something, not only to protect those that are in a nursing home, but protect our hospitals from being overwhelmed. It's hard to even find a bed in this town right now. It's an hour-by-hour situation. Our staff is getting sick. Our patients are getting sick. We need action, and we need cooperation. This is, you know, we are in Green Bay, Wisconsin. It's all about teamwork here, and we need to display that.
Dr. Ashok Rai, thanks so much for joining us. We appreciate all of your time and your message that it's not just about you, it's about everyone around you in your entire community, in your entire state, your country.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.